One of the amazing things about having our own surgery center is how we've been able to handpick our own team that we get to work with every day. And it's people that are the best at what they do. We have the best OR manager. We have the best circulators. We have the best scrub techs. And because we pick these people, we work with them day in and day out. They know my routine. They can anticipate my needs in surgery before I can even sometimes. That makes an operation go more efficiently, and a more efficient surgery leads to a better patient outcome. It's just an amazing thing.
I think the nice thing too about having our own operating rooms and own surgery center is that, you know, it's a Quad A state approved surgery center. So that's something to always check when you're going to a surgeon. Make sure that the surgery center they're using is something that's state approved. And also we have our anesthesia providers that we've had for years, and they're able to anticipate his needs, able to, you know, they know how long the surgery is going to be, and so you're not getting extra narcotics and not being asleep for extra long because they aren't sure how long the surgeon's going to take. Because I think people don't really understand that, you know, when you're at a hospital, you just kind of get thrown in with a team of people for the day. And it may not be somebody you've ever worked with before. And it can be somebody completely random, even for nurses. And that's stressful for the nurse, I can tell you, as being one.
Even if it's someone who's worked with you before, they work with other surgeons, and they may work with you on Tuesday at 2 o'clock. And so you ask for something, then it takes 5 minutes to get that. They know what I'm gonna need.
We have a team that's used to working with us and has worked with us for years. And I think that is so important, and it's so important for the patient that they don't understand that, you know, we're in the operating room all the time. So we know what happens at a hospital. He could wait 5 minutes waiting on a suture that they can't find, or, you know, that they didn't know we needed, or an instrument that, you know, a pack of instruments that's in a whole other part of the hospital. It's so annoying.
And the point is, 5 minutes doesn't sound like a big deal,
It's a big deal.
If that happens 20 times, suddenly that's 100 minutes. Suddenly your surgery is an hour and a half longer.
Yeah.
Through no fault of your surgeons, it's because your surgery happened at a hospital where the team isn't used to working with you,
and
or doesn't know exactly what you need, or isn't ready.
And they're unprepared. And so we don't have that here. Our staff is prepared for everything that we're going to need.